And we are back on Open Line. Chuck Long here with Dr. Karen Ray, psychiatrist. We are talking about mental illness, mental health. And I know a lot of you out there, whether or not you are experiencing it personally or you know a friend or family member who might be, we've talked many forms of mental health problems, depression. So many people do have these symptoms and they do have these real issues that they have to deal with. And sometimes it's hard to talk about. But we are glad that you're calling in this evening. We're going to go to the lines right now. Jay is on the line with us. Jay, good evening. We are glad that you're watching. And did you have a question or a comment for Dr. Ray?
Yeah, I think she answered it, part of it, but I've got a good friend who both his parents were killed tragically in a car accident, and he went through a very, very bad divorce, and he don't have any children, but, you know, I just needed to know what else we could do. I know my mom and dad are trying to be there for him as a parent, and he's 35 or 36, I can't remember now, but I just need to know. I mean, I've tried to keep him involved. I carry him to games, you know, and I'm just, if you got somebody that goes through that, I mean, always check on them, always call them, always text them, whatever you got to do, because, like I said, I've got a family of my own, and I just needed some more advice on what I should do, and I appreciate it. Thanks.
All right. Thank you so much for the question. So what would your recommendations be?
Well, first I would want to say that he's doing a great job being a friend. And I think what he's doing is really important. I think one of the couple of things to look out for would be that this person is sleeping enough and that he's eating and then keeping relationships going. And it sounds like your family is doing that. I would surmise that given the number of stressors he's had, that he would really benefit from seeing a counselor. This sounds like a pretty severe set of stressors in a short period of time. So I think that could be really helpful. And then I think the counselor would recommend a psychiatrist if that person felt that he needed medication.
Okay, and that's great advice. And we'll have some numbers toward the end of the show that we'll put up. How you can Centerstone is a great place that you could call for that kind of recommendation. There are others too, of course, around Middle Tennessee, but we will give you that number a little bit later. So, Jay, thank you so much for the call this evening. We're going back to the lines right now. Sherman is on the line with us. So, Sherman, thank you for calling in this evening. Do you have a question or a comment for Dr. Ray?
Yeah, I have a question.
Okay.
It's awful that psychiatrists refuse to participate in teen care. I think that is, I'd like to know, if you don't participate, I would like for you to tell me why you don't, what needs to be done, and secondly, in relation to that, what do you think of insurance companies that have drug formularies for antipsychotic drugs? Does that not make your job harder to do? And I'm going to sit back and listen.
Okay, well, thank you for the call. So we'll let Dr. Ray answer that.
Well, thank you for your questions, and I understand the concern. I do participate in the TennCare program. All our psychiatrists at Centerstone participate, and you can also use your TennCare program money and be seen at Vanderbilt, in the mental health clinic there, or at the mental health co-op. There are a number of places in Middle Tennessee where the physicians are part of the TennCare program. I think in Tennessee, we are able to get the antipsychotic medications we need. There are sometimes requirements for using a drug in a certain group before moving to another group. It does make for more work for the nursing staff who works with psychiatry to get those drugs, but I really believe we can get those medications in general.
Well, that is terrific. So, Sherman, we really appreciate your call, and that's a huge help, because a lot of times I think that's what happens. People are just misinformed. They think that possibly something is not covered that is covered. So this way, I'm glad that you cleared that up for us. Very, very helpful information. So again, thanks for your calls. If you would like to call or comment throughout the hour, again, the number is on your screen, 737-7587. We are talking about mental illness, mental health. One of the nice things that we talked about at the top of the show is the fact that this this is Mental Illness Awareness Week this week, right now, and then World Mental Health Day is this Saturday, October 10th, and we'll be talking a little bit more about those throughout the hour as well. Now, one of the things I wanted to ask you, we were talking about some of the traditional methods of treatment for mental health problems, but what are some of the new innovations in psychiatry?
Well, there are a number of innovations, and I think one of the innovations is the number of antidepressant and antipsychotic medications that have become available. One really important change is the ability to get a long-acting antipsychotic injection, to get a shot that lasts for a month, and now there's actually a new one that lasts for 3 months, and that's just coming out, and we will have to wait till that's covered by insurance companies and the TennCare pharmacy program, but that is on its way, so that's a big change. These drugs really make a big difference in treatment for people who have, for our patients with psychotic disorders. Then there are a number of other innovations. One of the ones that I'm very excited about is using genetic testing to help guide treatment decisions. We can do a particular test, an assay, to uncover what your genes are for 10 separate genes, and then when we get that medicine, we can learn which medications might not be very good choices for you because they might not work or they might produce side effects, and how we might need to adjust the doses of those medications.
And this is a relatively new test.
This is a new test. I began working with the Genomind company several years ago. They have an assay called the Genecept assay that predicts this, and I brought the swab that we use to get the sample from the patient. So it's just a little swab that goes inside the mouth and rubs in the cheek briefly, which we send off in a plastic test tube. It goes to a lab, we get the results, and then we have an interpretation from the company about which medications might be better choices for our patients. So this is really personalized psychiatry. So we're using a genetic assay to help guide our selection of medication.
Oh, that's terrific. And if someone were to hear on the show tonight you talking about this, what would be the process? Would they just see someone like yourself or someone, you know, at Centerstone and just say, I've heard about this test? And
I think the one sort of rule about this is it does have to be ordered by a physician, treating person, or a nurse practitioner who's prescribing for the patient. So it has to be a treating professional who orders this.
And you can see on the screen right now, if you're just tuning in, this is what we're talking about, the genetic testing for mental health. It's a comprehensive, simple to use, cheek swab based for clinicians to understand the genetic variations that best inform the patient responses to different psychiatric treatments. 62% of patients demonstrated clinically significant improvement with the Genecept assay. So that sounds very encouraging.
Well, that's really encouraging, and I often use this assay for patients who have not responded. So if I get in sometimes people who've seen 5 psychiatrists and had 7 or 8 different antidepressant combinations, and then when I get the test, it often points me in a little bit different direction. And our patients really love getting the results of these assays and then having hope that the next choice based on that is really going to either be more acceptable to take and more effective.
Well, and this is interesting too that we're reading right now. In patients who were treatment resistant, 69% of the patients demonstrated clinically significant improvement, with 91% demonstrating clinically measurable improvement with the Genesept assay. So again, very encouraging that news there.
Well, it is encouraging. One of the populations that I'm really interested in is the young adult population. So I end up seeing young people who have gone to college and who've had to drop out because they've become depressed. Generally, they haven't responded to the first antidepressant and the psychotherapy. Then they've gotten other antidepressants. They've had to come home from school because they're too ill. And it is really exciting to be able to get the test, make some changes, and actually see some of these young people get their lives back and go back to school.
That again, we're talking encouragement, and we're talking about, you know, new ways of treating, which is just terrific, and finding out what these symptoms are, which is terrific. Now, another study showed that 6% increased medication adherence in patients who were tested compared to matched controls. So kind of explain that to me.
Well, I think there are two reasons. One is our patients tend to take the medicines that work. So if your medicine is working better, you would be more likely to take it. The other thing is that when you know there's some science pointing in the direction of your choice of medicine, it really does instill hope that this might work, and people make an effort to comply with that.
Okay. Again, it's fascinating, it's encouraging. We're talking about some of the new treatments for mental health, and the way that this gene test just sounds very, very exciting, seriously. So we are taking your calls. 737-7587 is the number. We are talking about mental health, mental illness. Questions, comments, as always, very welcome. We are going to take a break, and we'll return with Open Line right after that.